is not the time to diminish the investment in the people that are the heart of the healthcare system.
Working 2 years through a global pandemic in healthcare, only to be hit with a proposed wage rollback, some as high as 10%. But Alberta Premier Jason Kenney is defending this move, saying it's a negotiation tactic.
There are no wage rollbacks. There is negotiations in the context of a new collective bargaining agreement.
The negotiations in question are between Alberta Health Services and the union representing a number of jobs, including pharmacists, physiotherapists, social workers, and respiratory therapists, like Holly Champney, who joined the opposition NDP Tuesday.
It's not just an 8% rollback. This negotiation feels like Jason Kenney has devalued our worth to this society.
Saying AHS's proposal that included various rollbacks based on position was demoralizing, and in the long run could hurt the ability to attract talent to Alberta. But the Premier says this is just negotiations, where two sides start with opposing offers and try and meet in the middle.
My understanding is that this particular union is effectively looking for a 15% increase over a few years. That is completely out of the range of what other unions have asked for or received in collective bargaining agreement.
Pointing to negotiations with Alberta nurses, where the government had started with a wage rollback, but they eventually agreed to a 4-point increase over 4 years.
Fiscal limits of the province, of taxpayers, but also recognizes the need to provide generous and adequate compensation to nurses.
They're simultaneously proposing to take wages out of the pockets of working Albertans who are getting us through the pandemic and put those wages into the pockets of company executives.
The opposition NDP pointing out the difference between how provincial employees are treated in healthcare and the minister's recent approval of potential wage increases between 3 and 39% for employees at Alberta Investment Management Corporation, or AIMCO. The finance minister's office in a statement asking that AHS and the Health Sciences Association of Alberta work together to come to an agreement that is fair to employees, but also to the taxpayer. In Edmonton, Carly Robinson, City News.